recording, and
Okay.
so I can share it on my YouTube page like before.
Very good.
So yeah, we'll just get started. It's 11:30. Welcome everyone. I'm just gonna kind of facilitate the questions in the chat. Feel free to ask in a chat. I think Provost has a few things he'll talk about, and then we'll get into a question and answer period.
Very good. And I did get some preliminary questions coming in last week, and I'll try to address them as broadly and quickly as I can. I think I'm getting my voice back. I went to the UVU BYU game last week, and I must have really been screaming loud. So I haven't quite yet recovered from that. But in any event, the first thing we really want to talk about, and I talked to Hillary about, is the online recordings and certainly what thoughts we have moving forward. Remember the online recordings, the auto recordings that were uploaded to the Canvas sites were designed to help us deal with COVID, to provide students who were either ill, had children who were ill, were symptomatic, whatever, that we did not want to be on campus or recommend that they not be on campus, would have access to those recordings for the class. And as I understand it, it was set up at the beginning so that we encourage faculty to allow students to have access to these recordings. You couldn't opt out of not having them recorded, but you could go on and unpublish them, make them inaccessible to students, or delete them as you. I'm getting some feedback. If you turn off your mics, if you're not talking. So that has been the plan. There's been an interesting wrinkle in all of this, and that there's been litigation has been filed against this system back from 2020 when we first went online. And so they've asked that things be retained and not destroyed while this litigation is pending. We're working to find out what implications that has. I've talked with General Counsel again this morning because it doesn't seem to me that it's particularly apropos to what we're doing now with these online recordings. But in any event, we are not able to delete or purge them from our system. Faculty will still have the same ability to unpublish, and we were even talking about whether when the semester ends, do faculty want to make that determination themselves, or do we just kind of go through and do a blanket everything? And I think that's kind of what I'd rather do, just blanketly unpublish them. And so students, nobody would have access to them at all at that point, except for the faculty member who owns that content. So the other thing to communicate about the videos, when they were made, there is an owner. The owner is the instructor of record, and they're put on the website. So the only people who would now have access to them would be the instructor and the IT people, the tech people, and some people in OTL who have to have access to that system in order to assist faculty with online recordings. But essentially, students wouldn't have access to it. And as once we get this litigation holds resolved, then you'd be able to go back to your ability to record and delete as you so see fit. So there were some questions about the recordings, and I'm going to just kind of quickly deal with those. Can you assure faculty that recordings of classes will not be used for purposes of classroom evaluation? I'll send this out. And I ask again specifically this morning, chairs don't have access to this, deans don't have access to these recordings. I don't even have access. The president doesn't have access to them. I'm told the only people that can see the recordings are the instructor and the tech people. So I'm happy to send out a message that, these should not be used. The only purpose they were to be used for were for assisting students through this COVID epidemic, to give them access to the classes. So right now I can assure you that they couldn't be used for evaluation purposes because nobody has access to them who would do the evaluations. And we'll make it clear that no one should be trying to gain access to for that purpose. So in my conversations with tech support, they said that, yeah, we would have to give authorization for somebody else to get access to them. They currently don't have it. Does the university believe it owns a share of ownership in the content created? There is, in fact, a IP policy at UVU, which is kind of broad and in some ways says that basically the university owns anything that you create that you were paid for, which I guess would include all course materials and stuff. But I talked with legal this morning. There's no desire that we're claiming intellectual property rights or planning to use any of these materials in any way other than what it was intended for, which was to give students access to them. And again, once the litigation hold goes away, you'd be able to delete that data, that material if you don't want it or don't need it, and therefore we wouldn't have access to it. So those were a couple of the questions about the current status of things. So at the end of the semester, they were asking me for the date, and I'm happy to get some feedback from you, but my feeling is that once final exams are complete, we just turn off access to any of these videos, so nobody would have it. Ostensibly, it's quasi deleting them. You would still have access to them as the instructor, so you could save those videos, use them however you want. And I'm hoping that we'll get some resolve to the legal issues and be able to give you more information about that as we move forward. It's an unusual wrinkle in things and one that I wasn't certainly anticipating, but it kind of is what it is, and we're wrestling with that. Mark has his hand up.
I had to mute myself for a second. Thank you. My question is that since this was a policy or a practice that was implemented due to COVID-19, does that mean that once this pandemic subsides, we plan to abandon this practice?
I think the auto recording is something that we need to discuss, and I don't think that we're going to have a robust conversation about it here. I think that certainly the just regular auto recording of all classes is something that I don't anticipate would go into in perpetuity. I think that there probably are some instructors who've now gotten acclimated to it or like it, or that it actually, the idea of a student being able to go to a class and confused about a subject, and instead of, making office hours for the faculty member, can go back and watch that class 2 or 3 times or however many times. I've heard stories through the pandemic of faculties, they were in the sciences, the one that were talking to me, that said this was actually pretty helpful because they could go back and they could watch the segment that they didn't understand repeatedly and then come to the instructor with specific questions. So I think it has value. That being said, I think that we're going to have a lot of discussion, a lot of faculty buy-in, a lot of conversation about it before we move on. So now the policy was implemented to deal with the COVID crisis, and so that's fundamentally what we're talking about now. But it is a technology. We've got millions of dollars we spent putting that equipment in the classrooms, and I would hope that faculty would make effective use of it for the benefit of students. And, even after COVID, there are still going to be students with kids who get sick and have to miss, they're not sick, but they have to miss several days of class, or they have all kinds of situations that we know have gone on for eternity, really, with students in the classes. And so the technology can be there. Another way could maybe if we could figure out the tech part so that the courses are recorded. Again, you don't, as an instructor, maybe don't even publish them and then provide select access to students who missed that class. Could be another way of dealing with it. But it's a complicated question. I think it's one that faculty senate and faculty need to get involved in. That being said, spring is not looking like it's exactly going to be a COVID-free holiday for us. I think that we will still have some of the same types of issues we were facing in the fall. I do have Robin and Sue Jackson here because there were some questions about on-campus safety and masking and the vaccine mandates. And, we've done what we are legally permitted and kind of put our toe right up to the line on what the legal allows us to do in terms of masks and vaccine mandates. And these videos were another tool for us to help provide a safe campus by encouraging anyone who might be symptomatic or have, been in close proximity to someone who was tested positive for COVID to have access to the class. So that's probably a really long answer to your question. But the issue is, yes, the question we're facing right now with the policy and the question about how we're going to manage this in the spring, which my recommendation would be that we continue the year as we have been, recording the videos, putting them in your websites, and giving the faculty member the discretion, again, to turn them on or not. We'll have to deal with the issue of whether they're deleted or not with the legal holds that we have in place, but you still have, and I'll have always had the ability to allow or not allow students to have access to those videos. So that being said, that's kind of where we are currently. Until just recently, you could have gone in and deleted the videos yourself. Again, you can still go in and turn them off. You can't now delete them, but ostensibly you're the only one, again, along with tech people, who would even have access to them. So they're locked down. From my perspective, they're yours. They're your course materials, just like anything else you would prepare for class. It's your intellectual property. It's in your name. There was some question about how we're managing that, but those files are in the instructor's name. They're your intellectual property, and they're posted on your course website. And the university has no intent of using them in any particular way. The other thing to keep in mind about these videos, and I've said this and I say it, I don't know what the actual commercial value of them would actually be. There's a lot of really high quality, high production videos of a lot of the stuff we teach already out there and available. And these were just, recordings of classes. What really is the meaningful experience that students have is the engagement with the instructor and the faculty member, not so much just watching a video. So we have no intent of using it for any purpose other than what it was designed to be used for, which was to give our students an opportunity to stay engaged with their class, given the challenges of the pandemic. Hillary.
Yeah, thank you. I think faculty just have a few other concerns around the
Sure.
videos. I know you say there's no intent to use them for evaluation, but in a case that could a supervisor ask to see the faculty's videos, or can we get some sort of a statement or assurance or some sort of like, I don't know if it's like a faculty senate thing has to oversee, like if that would ever happen, how can we make sure it's not just happening like in a situation behind the curtain, kind of not out in the open? I think faculty are concerned over that.
Yeah, I'm happy. And right, as I said, right now, only those people can access it. If I were to grant access to it, for some reason, maybe that we talk about having the faculty senate president or something notified or aware, or certainly the faculty member made aware of it. The only thing now that I could imagine a situation could arise is if there were some claim of some behavior, something that happened in class, some illegal activity or some faculty members yelling, making racial comments in class or something. Then the university might go back and look and see if that were there and hopefully vindicate the faculty member in most cases. But there's no, we're not going to, and I will make it, the policy is not that these, we just can't let these right now be used for course evaluation purposes. If we decide in the future to use them in a particular way, I think that using this type of material for yourself for evaluations can be especially helpful. If you never sat and watched yourself teach a class, that can probably be one of the most painful experiences and one of the most helpful experiences that you can have. I've done it myself. I've done it in other sorts of things that I'm involved in. But if you're not watching your own videos, it might be a good thing to do and use it just as a developmental tool. And I think that the video should be used for that type of purpose. They can be really helpful for enhancing our instruction, but not right now for assessment. No, that we're not going to turn them over for annual reviews or those types of things.
Okay. Yeah, I think it'd be nice. We all like statements and just reassurances. So maybe you and I can work together to
We can.
put a statement together.
And Rick McDonald has in here, so they are owned by the university. Per policy, the policy says that anything that you are paid to create or develop as an employee of the university is the property of the university. So that extends way beyond this conversation of what we're talking about videos. But just like we don't typically come and collect that information. That's something maybe we want to look at in the IP policy as well. I just want to assure you, we're not looking to use these videos for anything. Lynn said that would still be problematic. I guess something that I was saying, I'm not exactly sure what I was saying that would still be problematic, maybe using them for, I think I was talking about using them for instructional purposes, but again, that would be, right now, would just be the instructor deciding to do it. The issue with the choice is that all other course content we create is done voluntarily. These videos are not. A good point that I guess if you're creating other content other than, assessment tools and things that somehow you have to assess, we're paying you to assess students, and I guess you could buy that IP policy, maybe your tests or the university's property, I don't know. We're not claiming any property interest in these right now with these videos. But it is an issue. I mean, it's something I think worthy of conversation, but it's really a matter of policy and not sort of the practice about how we're using the videos.
Well, on that, I don't think the videos are in policy anywhere. So if we're going to continue to use these course recordings, I think it's probably worth making a new policy or somehow getting this in policy about exactly how and they can and cannot be used. So that's I think this is, something that's pressing for Senate in the spring, because spring is going to continue, and we've known that pretty much all year. But then for the next academic year, that has not been decided. So I think this is something in spring that we should really get to work on.
I think that we should. I agree with you completely. And I'm absolutely happy to work with faculty to develop a policy that's comfortable for everybody around this. I know that, I don't know exactly I guess there are probably multiple concerns that are coming up around this. And just happy to address those because I don't want faculty to be concerned about the university inappropriately or using the videos or feeling that they're being taken advantage of. So certainly not my intent.
And maybe Lynn, do you want to go ahead? You can help us understand more concerns.
Yeah, I think I'll address that would be problematic comment. It was in reference, Provost Vaught, to your comment that, well, if we get a report that the faculty is, I don't know, swearing or using slurs, or I can't remember exactly what you said.
Yeah, there's something like that. But
I said that my reference was that would still be problematic. That seems legally problematic in so many ways. And as Mark pointed out, those aren't voluntary recordings. So that's what I meant, is that it's still problematic because if you can go do that unilaterally, then this is the issue. And so I would like to just sort of reinforce what Hillary said, even if it's a temporary, so maybe there's not a policy yet, but maybe there should be, get a temporary statement in place that maybe, as Hillary said, she and you work on, because we don't know how long this is going to go on, but look how long it has already gone on. And so we've been saying this semester after semester, and I think it's time for us to say, let's get a statement and work on a policy, because we actually don't know if the 21st century, this is going to be an ongoing issue for us. And if so, it'd be better for us to have the policy, have it go through the vetting process and have it in place. But in the meantime, because we're going on 2 years now, we need a statement. Because again, I agree with what Mark and Rick and others have said. And I really do believe it's a legal issue if videos are used, even if the administration thinks that the faculty is doing something wrong or against policy in a classroom to go in and look at those videos. So anyways, that's what I meant by still that would be problematic.
Oh, gotcha. Yeah, and again, I think somebody told me there are 300 and some odd thousand videos. Imagine all the sections of courses and all the days. So we're not going in and look. I don't have access to them. I couldn't get in right now and look at one. If I wanted to, I would have to get authorization to do it. But your point's still well taken. And I think it's well taken in the sense that while we're dealing with COVID, and Mark's question earlier, what about post whatever? I think that we got this technology. There are some good ways that it can be really beneficial and helpful to our students. And this has kind of forced our hand to really come to a reckoning with the technology, how it's used, and policies surrounding it, because they're just not there. And absolutely happy to work on that in conjunction with faculty so that we come up with something that we can all be comfortable with, but also something that can really help us. I mean, at the end of the day, my question always is, what's in the best interest of the students? And so how can we use this in a way that's in the students' best interest, but also recognizes and respects the rights of faculty members surrounding their course content and things. So absolutely happy to work on that. That being said, we do need to make the decision, and again, my recommendation is we just continue spring like we have been for the fall. Again, recognizing that while the videos are being made or would be made, that you still, as an instructor, would retain the ability to publish or not publish those videos, which means that you, at the end of the day, control access to them completely. So if you don't want your students to see them, they won't. And that's the same thing we did for this fall semester as well. And my guess is that we're going to get past this litigation hold issue, and you'll just be able to go in and delete them at will. So then it wouldn't even be an issue. We wouldn't have access to it. Any other questions or concerns? This isn't, obviously I can't take a vote I think we do have a few people here, but we're not sort of a representative body of the faculty per se. It's 67 people. Maybe I'll go back to faculty senate here. There's one more meeting tomorrow, I guess. But my sense is that we should continue on as we have been. I think that will provide the least amount of disruption. And now with the new variant coming by, and we're not mixed. I'm reading mixed things in the media about what the implications of that are. And I asked Sue Jackson, who, told me this was only supposed to have lasted 6 weeks or something, I think she said. Just kind of joking. Robin as well. Remember those days. But yeah, you're right. This has gone on into 2 years. So they are here as well. If there are any other questions about the fall semester and our COVID response, but this is one of those things. The other, go ahead.
I was just gonna say, I think that's what's coming up next. Some questions about
there
COVID
were some
next semester, so maybe we can transition there unless you had other final.
I'm happy to do it. There were some questions again. Rick McDonald on behalf of AAUP and the blanking on the other name, the AFT.
AFT, yeah.
Members just wrote a series of questions, and some of them were about our policies, both past and in the future, regarding masks and vaccine mandates. And we did mandate, basically the mandate in the spring was that everyone had to be vaccinated. All the students had to be vaccinated unless they didn't want to be, essentially is the way that mandate turned out. I mean, we complied completely with state law. The mandate was in place to do everything we could to encourage students to get vaccinated. But by law, we can require it, but we have to provide exceptions for medical, religious, or personal exemptions. And so K through 12 does the same thing. And so that's what we had in place. As we surveyed students, mandating that they actually complete the survey, we hovered, and I haven't checked it in the last week or so, but we were about 75% of the students who completed that survey said that they had either been partially or fully vaccinated, and most of those had indicated a full vaccination, that they had been fully vaccinated. So we have a pretty high rate of vaccination on campus, as self-reported by students, which really is, I was kind of shocked by the number myself when it was first coming in. So that's a very positive measure. And then the mask mandate, similarly, we had it in place the first semester. State legislation does not allow it. I know there was a question on here about how do we reconcile the author of that bill who sits on cabinet with the university policy. And a couple of things I'll say about that. The bill itself doesn't actually prohibit universities from requiring masks. It just, they can't do it without authorization from the county health department that's overseen by the county commissioners. And the county commissioners have gone on record as saying under no circumstance would they allow a mask mandate. So that's kind of where that sits. It's not really the state forbidding it. It's just that tossed it down to what they thought was the appropriate local level, and our local officials aren't willing to allow us to do it. And I know there had been some conversation with them about that. So that's where things are with the mask mandate. And in terms of the individual, Val Peterson, that we're talking about, also how does that reconcile with cabinet? Val, in that, as a representative on the legislature, does not represent UVU. He represents his constituents. And I believe in recommending that bill, and the various people who voted for it believe that they were reflecting the will of their constituents, not the will of the university, which did require masks when we had the option to do that. So if you have questions about masks or the vaccination policy or the health and safety of the campus, I did ask Sue and Robin, who help us coordinate that. Keep in mind that we're not just, certainly not me, and up here just making decisions about health policy and health and campus safety. We do have local experts that we've relied on to help us with that, and they can give you an update both on it. I don't think we had any building flags recently. I think they can talk a little bit about our monitoring, but we have, since this began and through the last semester, continued to monitor classes, monitor cases, contact classes, flag buildings, so that we can do everything that we can within the abilities we have to provide a safe and healthy campus for our students. And Robin and Sue, since you did come, I appreciate you taking time to be here. Anything that you can say to faculty about our policies and about your general assessment of the safety of the campus, and especially things that we might be thinking about as we go into the spring with new variants being recognized.
So just a couple of things I guess I would add. If you don't know, we do have a vaccine clinic on campus, and we are providing boosters for those of you, which is everyone at this point in time over the age of 18 is eligible for a booster. So if that's something that's interesting to you, we do offer those boosters on campus. You have to be 6 months past your last shot if you got Moderna or Pfizer, and you can be 2 months past Johnson & Johnson. And the CDC has approved, if you want to mix and match, if you got Moderna and you want to try Pfizer, you can do that. There really isn't, that I know of yet, any numbers or evidence that shows, some combination is better than another. I think the reason they did that mostly was because you may have been one place and got Pfizer, and now Moderna is the only one available, and they'd rather you have a booster. So the mix and match comes more from that angle than that some recipe is better than another one. The other thing I wanted to mention as well, just by way of information, as far as what we're doing on campus, we're still doing classroom monitoring just like we always had from the beginning. So as students become ill or staff or faculty become ill, we ask them to fill out a self-reporting form. This triggers contact tracing, but it also triggers numbers that Sue and a group of people look at, and we're still doing classroom triggers. I don't think we've had a class have to go to an online environment or live stream environment as a result of having a kind of a little mini breakout, but we're still doing everything that we have done from the beginning of time, meaning when COVID started, not the beginning of actual time, although it feels that way. So we're doing all those things. As far as facilities goes, you know, we talked about filters early on. They've changed filters. They continue to change filters. We early on changed to a higher degree or a higher quality of filter. There's mandates and regulations that say what kind of filters you have to have and where. And we kind of upped all of our filters at the beginning, and we continue to maintain those and change them out. As far as cleaning goes, nothing has changed for custodial. They continue to do that kind of cleaning. I think we've talked about the mask mandate. We can certainly recommend. I represent UVU on a USHE meeting every week where all the universities are present, and we talk about the vaccine mandate, the mask mandate, and they feel very similar to as we do. And so we do push from that USHE perspective back to the state health department, concerns about the mask mandate. The other universities in the state have had a similar experience as far as vaccines and how many students are vaccinated on campus. So that actually made me feel a little bit better about our numbers because they're consistent with, you know, our two kind of larger universities in the state as far as numbers go. As far as if you were to compare where we were last year to right now, last year to where we are this year, we're doing much, much better as far as numbers go. And if you're interested in looking at those numbers, we do have a dashboard on the uvu.edu/COVID info. At the very bottom of the page, you can see where we've been, where we are, and we're kind of hanging in there. I feel like we had a little bump because of Thanksgiving. Some numbers went up, but again, not in an outrageous way. And I think a lot of this has to do with the fact that we have a pretty high degree of vaccination on campus and natural immunity. Now, you know, we don't know how long that natural immunity lasts. Will it wane? It usually does wane. It's very individual to the person. But over time, you know, it is going to wane. And that's why we still push for and request people to be vaccinated, get your boosters, that sort of thing. The other thing I would add, I'll look at these questions really quick in a minute. I just want to say this while I'm still thinking about it is, we are watching the Omicron variant. We really don't know, you know, very much information right now. As of yesterday, no one in the United States had been hospitalized because of it. So that's kind of a nice thing to know, although I'm sure that will change at some point in time. It has arrived in Utah, we know that. So we're just kind of keeping an eye on that like we did with the Delta variant and all the other variants that have come down. Don't really know what it means yet. It's still very early on to say, is it more contagious? Is it more virulent? We don't know. So we'll just kind of keep an eye on that, watch for it. It's too early to say probably whether vaccines cover it or not. I mean, there's some people speculating on that, but I think it's just it's a little too early. We just don't have enough numbers to say things like that. But again, monitor, watching it, just kind of like we have been doing. My biggest concern right now is that we are entering into flu season and we still have COVID with us. So last year, because of just precautions and things that we were doing, we had hardly a flu season at all. I mean, people still got it, but it was so low. It was basically a flat line, which was fantastic, but it won't be like that this year. So, you know, we have the percentage of people that get flu vaccines every year, you know, and it's the same, it seems like it's the same group, but I think it's hard to predict, but we're going to have two things going on at once. We're still going to have COVID. We'll see what Omicron does, but Delta is still out there causing trouble. And then we'll have flu on top of it. So we go back to the same things we've been saying the entire time. If we could get people to not come here sick, we would be able to stop the spread. but we still have people who come to class, to work, while contagious. This still happens today. So if we can, if there's a message, that's the message. Do not come sick. Please stay away if you're sick. Get tested. It's available. It's free. Come to campus and get tested. We're happy to do that for you. But please don't come to work sick. Don't come to class sick, things like that. That's our message. Certainly all the others also are still in effect of, wash your hands, don't touch your face, those things. But probably the bigger one for me is just don't come here sick. If you're, there's other cold viruses out there for sure, because it's December, right? Come and get tested and find out. There's different rules, if it's just a regular cold versus whether it's COVID. And we can help you through what you need to do if it is COVID related. If you fill out the self-reporting form, that is key for us in helping us to know about disease on campus and how to approach classes, what to do if we need to do extra testing. There is nothing that says we can't test. On campus, our policy for testing has been for those students who are in close contact with each other, for example, aviation, they get in a plane together, dance, they engage with each other. I was just talking to someone from the theater department. They're in close contact with each other. So there's a variety of situations where the students are actually quite close to each other, and there is a testing requirement in those classes. And that's basically, there's nothing that says we can't test, so we do test quite a bit. So if they are not vaccinated, we ask them to be tested. The way we say it is that we require testing, and if they have been vaccinated and they want to opt out of testing, then they would need to show a vaccine status or a vaccine card to their instructor. So it gives people who are vaccinated the choice to do it or not. As you well know, that there's some sensitivity for people giving up their vaccine status. So we don't make them give up their vaccine status, but if they're not going to do that, then we do ask them to get tested, because there's nothing that says we can't test. So we continue to test. All of these things that I have said will continue on through spring semester. For now, I can say that for sure. We will remain having our testing clinic, our vaccine clinic. We will continue with monitoring classrooms and buildings, and we will have contact tracing will still be in full effect. So we really haven't let up, except that the actual workload has changed because we just don't have as many people getting sick on campus as we did a year ago. Our three big spikes were November, December, January last year. So we've kind of had a little bit of a bump post Thanksgiving, but nothing like last year. And we'll see how December and January go with flu on top of it. That'll be interesting to watch. But the precautions for flu are exactly the same for COVID. They're the same. The other thing I would mention, some of you know I have a background in nursing, an ER nurse, and I still work in the ER on the weekends. I was there this last weekend. And so I keep tabs on, how the ICUs are doing, especially specific in Utah County, what the load is. And the thing right now is that there are a lot of people, the ICUs are full, but they're not necessarily full of COVID. About 40% of what's in the ICUs currently are COVID, with a high percentage of those people being not vaccinated. About 90% are not vaccinated. And I think the bigger problem is that they're able to manage the ICU patients. It's just the fatigue is just beyond fatigue at this point in time. Healthcare workers went from being heroes to enemies. So that's been an interesting transition to become the enemy. As far as, I'm not sure how that happens, but it definitely has. And so there's just a lot of just mental, emotional fatigue in the healthcare workers themselves. They are able to manage the big numbers that are in the ICU. From time to time, they go over, board, but they have plans for, where to overflow to, and patients are taken care of. It's just, I think it's fatigue. It's just utter fatigue at this point in time. They've seen quite a few in the county, nurses, tons of experience. They're done. They've retired. They're done. They would have worked a couple more years, but they're leaving early. And so you're hiring brand new nurses to replace a seasoned ICU nurse, and that's always a little bit frightening. I mean, they won't let you loose as a nurse taking care of a patient unless you have the skill set to do so. But it's still just, that's kind of where we're at in nursing. And probably, I can't speak for the other health allied, like respiratory therapy and everybody else, doctors, but it's not going to be far off from where the nurses are. So I'm going to just scan really quick.
And just sort of
Sure.
quickly say, so, I mean, this was
Sure.
really one of the questions 7 was about the robustness of the reporting protocols and procedures. So Robin's giving you a pretty good overview of what we're doing. That combined again with the recordings, because as she's pointed out, don't come to campus if you're symptomatic. Don't come to campus if you've been exposed. Stay away. And again, that creates the need for us to continue giving those students access to the class recordings. And another thing that is kind of sort of related, but it's not COVID, and I'll just kind of change our direction a little bit. Since we're anticipating some inclement weather this year, we're going to be getting out some guidance on that. And really, it can be basically, there will be 2 scenarios, one where there's snow on the Orem campus and we have to close the campus down because it's unsafe to try to get onto the campus itself. As I understand, that's fairly rare. And typically we get up, Robin's one, I get up at 5 in the morning, somebody's going out, looking at 5 mile a radius of the campus, but mostly looking on campus. Our crews here, sidewalks clean, is it plowed? And if the answer is yes, then campus will remain open. If the answer is no, then we close the campus. But as I've sort of jokingly said, one thing COVID did kill was the snow day. Because of the technology, because you can live stream your class from your home, in the event that we close campus, we would still expect the faculty would be able to engage with their students in some way. And so that could be, again, live streaming the class from home or providing them an alternative assignment or whatever it may be for that day. Alternate 2 would be that the campus remains open, which is the most likely in scenarios. But again, we can have a couple of years ago, back, we were jokingly saying, I wish that our worst problems were figuring out whether to have campus open or closed for a snow day, because we had one of those situations right before COVID closed down the campus there in that December of 19. But no matter what we do, we get yelled at, which is the interesting part. If we close campus, people are upset. If we don't, people are upset. So if there's no snow at all in Orem, but there's 15 feet of snow in Draper, that creates a problem. And so while the campus may be open, it could be that a faculty member can't get to campus or students can't get to campus. And in those days, again, you just need to be cognizant of that fact and communicate with your students. So what we are then proposing is that really faculty just need to have a plan in place for how they will engage their students in the event that either the campus is closed and nobody can get here, or the campus is open, but either the faculty member can't get to campus or lots of students in your classes can't get to campus. And then again, the video recordings that we'll be doing is an alternate that those students could use if there's snow in their area and they can't get to campus, but the campus remains open. So we'll be sending out some wording. I haven't heard anything I think Thursday and Friday, there's supposed to be some possible snow, but I don't think anybody's predicting anything that would be so significant that it would shut things down. But around here, you just really never seem to know what's going to happen with a snow plan. So we'll be getting that messaging out to faculty, but I just wanted to give you a heads up. Hopefully it won't impact us too much for the rest of this semester. But as we get into January and February, we could start having some inclement weather issues. But the technology now gives us a way of engaging those students similarly as we're dealing with COVID. I'm kind of looking at.
So I can answer the question about the flu.
Oh,
we-
yeah, go ahead, please.
We did have some, I mean, so HR every year has, I think it's Costco that comes to campus and offers flu shots. I think those days are over. So we are not offering flu shots in our vaccine clinic. So if you want a flu shot at this point in time, you'd need to go to either your healthcare provider or pharmacy or someplace else. But I believe they added a couple of extra days this year to get flu shots, but I believe those are over. So that's the deal about the flu shots. And then there was another question about the self-testing kits for faculty. We just have the kits we have, which we get from the state health department. And so we would just, I would encourage faculty, come get tested if you wish. It's a rapid test, so it takes 15 minutes literally to get the results, but it takes another hour or so for us to get that emailed to you. But we don't have self-testing kits available to us.
Right. Following up on that, though, my department chair was going to order testing kits for faculty before the semester started. So we're not asking for yours. We're asking for our department chairs to be able to purchase those for their faculty if they want, whereas they were not allowed to do this last semester. But seeing as this is an ongoing thing, I think maybe we can revisit that and see if that's something that can be made available.
So, I mean, we do have testing on campus, so
I mean, a lot of people live super far away, and if you feel like total terrible, you shouldn't come to campus, right? So I mean, I understand and I appreciate and I take advantage of the on-campus testing, but it's not a solution for everyone.
Okay.
So I'll follow up with you, Provost, about that.
No,
too.
absolutely. Yeah, happy to talk about that.
Okay.
And what
Are there other COVID questions, or maybe I know there's a few 15 minutes left, and yeah, there's kind of a few other questions that I know folks had. And yeah, I agree with Mark that if you're saying to stay off campus, then, or maybe open to more drive-through testing like we've had before.
We do have drive-through testing every day from 9 until noon. There's somebody that can do drive-through tests. That's where we ask our symptomatic people to go so that we don't have a mix of symptomatic and asymptomatic. So the symptomatic people will go out to the drive-through. So we do have that every day.
Again, it's great for me. I live in Orem, but there's so many of my colleagues who live really far away. And so,
So the 9 to noon is based on people coming. I mean, we have to pay for people to be out there. And we were open all day earlier because we had bigger numbers. We just don't see big numbers at the drive-through right now. So we kind of base that on need. If we were to see a bigger need out there, we would definitely expand the hours. We watch that all the time. But yeah, the reason why we're at 9 to noon is because of the actual number of people utilizing it.
And I can let me jump in here as well. Not to the counter argument to some of this is that we've got to start to look at COVID as another infectious disease. I mean, we're 2 years in; it's never going away. COVID will be here forever. We will have variants forever. If you want to be vaccinated, for the most part, you've had the opportunity to be vaccinated. And the problem is that we are not, we're not where we were 2 years ago. So the reason that this was such a crisis 2 years ago was because it was novel. We didn't know anything about it. We didn't know how to treat it. We didn't know the prevention. And so that's what shut everything down. At this point, we know some of the prevention, at least in vaccines. We know some of the treatment. They're getting better and better at treating this in the hospital, some drugs in there as well. And so we are going to have a level of COVID on campus forever. But we also have a level of flu on campus. We have a level, I mean, we could talk about all the diseases we have going around campus. We probably don't want to do that because I'd gross you out. But there are plenty of diseases on campus right now. And so we do have to shift to say COVID is one of many infectious diseases that we have going on. And how do we make sure we don't have outbreaks? And we are still watching for outbreaks. I'm still counting cases. The cases are at endemic levels. So in epidemiology, we talk about stable levels. We have been endemic all semester long. So we are between we had the low of 7, which was Thanksgiving week, which is expected, a high of 39. So we are right in that phase, and that's student cases every single week compared to last November where we had 144 in 1 week. So from a science perspective, I'm looking at it saying we have a constant level of disease and probably no different than flu and colds and other diseases. So it may be that we get to some point where you have COVID, you want to be tested, it's on you to be tested. Just like if you woke up and had flu symptoms 3 years ago, it would be on you to find a flu test before you came to campus, and please don't come sick. Just one thought.
I'm going to have to concur with the Sue. We are
Mark
getting to the point where it's just another disease on campus, and where, you know, I know that when people get very sick and hospitalized and go on to die, they do that with flu as well. And we're kind of at that level. And so.
Couple hands up, Mark and Rick, I think. Mark, go for it. You're muted.
I am muted. Yes, thanks for pointing that out. Okay, now I can speak. So one thing that I want to sort of contrast is that the videos, going back to the videos, this was something that was done as a robust response to the COVID crisis, and this is an ongoing crisis, and there's a sort of emphasis. There's still a crisis going on. I agree with that. The concern I have is the difference in emphasis and force in the phrasing that went around the vaccine mandates and the emails that sent out, and how we went out of the way to allow, without any second guessing, as many exemptions as the students wanted. The messaging really did not lean on responsibility. And what is concerning about this is that it does make the campus a very unsafe place for those who have legitimate medical exemptions, compromised immune systems, or other health concerns. And for them, COVID is not the same as flu. If we are trying to propagate a culture of care for all, we put more emphasis on the responsibility and consideration for the vulnerable in this messaging. So I have heard from people who don't feel safe on campus because of the lax inclination to actually have a vaccine mandate, or even a sort of culture of masking that's not present that could help. There's only so much we can do within legislation, but I do believe we could do better for culture.
Yeah, we did send out messaging to students, certainly encouraging and trying to do everything we could to entice them within, again, the constraints on us by the legislature there. And as I mentioned, the turnout of having 75% of people saying that they had been vaccinated, or that in a number that were planning to get vaccinated, was a pretty robust, I think, response to that effort. You know, there was conversation about, you know, just how aggressive we were going to try to be. We don't, and UVU has never required vaccination for anything as a condition of enrollment at the university. Other schools have and had things set up to deal with that. But, you know, at the end of the day, there were conversations. No one was going to sit here and decide what were legitimate religious exceptions or not for the 30,000 students. No one was going to decide whether, you know, really look at someone's health record and make a determination about that. And then the third category of personal exception is so broad that basically anyone, for any reason, I don't like needles, is a legitimate exception. And so were we going to spend a lot of time and effort and personnel going through these when people could just say, I don't like needles and I'm not going to get the exception? So the emphasis was on doing everything that we could to encourage as many people as possible to get vaccinated. And I think our response rate was pretty good. And I don't know about the number of students, Barb or Robin or Sue can tell us, but I think we did have a lot of students taking advantage of our clinics and coming on campus. You know, we've got vaccines and testing set up right there just above the grand ballroom. And so I appreciate that. And, you know, there was a sense of where I kind of wanted to be more draconian with it myself. But on the other hand, our hands really were kind of tied, and you're going to be punishing students and forcing people, especially a lot of people who were doing their jobs and who were, you know, getting vaccinated. Now we were going to force them to come up with documentation. It just didn't really seem to make a lot of sense. The net benefit didn't seem to outweigh the burden that would have been created for those students. And so that was kind of the decision that was made. Rick, or Robin, if you want to say anything else.
Just a quick thing about, I've heard for 2 years how unsafe campus is, and I don't want to come across defensive at all, but we've tracked and tracked and tracked people on campus. And there has been, we've definitely had people giving COVID to other people while on campus, but it is so small. It is so small, the transmission actually on campus. Like I have no control over what people do when they leave campus. But what we have done a year ago, and even what we're currently doing, our transmission on campus is very, very low. And I think that's a result of everything put together, right? The aggregate of everything put together. But I bristled just a little tiny bit, to be honest, when people say how unsafe it is here. I disagree. Politely, I think it's very safe to be on campus.
Rick, you will have the last question, I believe, for the day.
I'm sorry about that, and get prepared to bristle, because
Okay.
I think what I've heard here today is that, like, we're doing great and everything's fine, right? And I'm not so sure that that's true. I'm not even so sure that that's what the CDC says. Of course, this is coming from an English professor, so you don't have to take me seriously. But I see a lot of people not masking, and maybe our medical professionals on campus believe that masking is not necessary anymore because 75% of our people are vaccinated. But I'm pretty sure that's not true. But I mean, that's the feeling I'm getting, right? I don't feel like the school is really pushing very hard to get people to mask, and I don't feel like we're pushing very hard to get vaccinated. We're doing plenty of things, and I appreciate I got my booster at UVU. I'm thrilled with that, right? I think we do a good job with tracking, but a lot of students don't report, right? Like, you tell them to report, and I have no idea whether they do, and I know at least some of them don't. They don't take it very seriously. If they're not super sick, they don't care that they're spreading it. I'm not so sure I don't have a moral obligation to stop teaching face-to-face, but I also am not sure that I don't have a moral obligation to teach face-to-face, because then the only people teaching face-to-face are the adjuncts, right? Because I am, by the nature of my class, spreading COVID, right? And I don't think we're all that worried about it. Like, I don't even know if it's, if what we need is, I don't know, people with masks on posters, or the brand new web movie that shows up when you get to UVU. Nobody's wearing a mask. Now, I get it. Like, who wants to show a picture of people wearing a mask, right? But the amount of masking on campus has plummeted over the course of this semester. Like, I ask my students to wear masks, and maybe 30% of them do. Maybe that's because they have no respect for me. I don't know. But I see that the numbers are lower than 30%, but maybe I'm wrong. I'm an English professor, right? Maybe we don't need to mask anymore. Maybe Omicron is nothing to worry about, but we're just going to have more Greek letters show up if people don't mask.
So thank you. I appreciate all those comments. I think we talked about earlier, we in the beginning, we required masks so we could. But we can no longer require masks, and that is by, we in and of ourselves cannot require masks. If the Utah County Health Department would make that requirement, then yes, we could require masks. So we're doing what we can do, which is highly recommend, we recommend, the signs are all over the place still that say we recommend masking. At the end of the day, people do have that personal choice whether they're going to or not. But it isn't for our lack of wanting to have people in masks. It's just we're doing what we can do as a result of the laws that we have on us. And then as far as I forgot what else I was going to say, but we're doing what we can do. But like I said, it's personal choice for both vaccine and for masks. We send out lots of messages. There's a whole website devoted to, vaccines and masking and information. And, we have sent out message after message, but at some point in time, people need to make a choice. And we are not able to require masks, so we can only recommend.
And I got a hard stop here in a minute, so I'll say, Rick, if you or others have ideas about things that you think that we're not doing that can be more encouraging or more enticing to get people to wear masks, I'm certainly happy to consider it. But we didn't take down the signs that were put up when COVID began. We don't have anything that says they're required because we can't. And then, it's not just students. I kind of walked around and looked in classrooms, and a lot of faculty don't wear masks either. I mean, it's it has become, I was surprised at how many there were actually even at the beginning of the semester, but then it's kind of tapered down. But I agree with you that anything that we can that would encourage vaccination, anything that we can that would encourage masking, and any clever ideas as to how we can do that, I'll be glad. I know that the president, she almost always has her mask on campus when she's at events, sporting events and things, she's wearing a mask. So I think she's trying to set an example in that regard, but it's a tough, our hands are kind of tied to a good degree with what we can force to happen. So that being said, I do need to step off. We'll continue to engage in, certainly I will continue to engage with Faculty Senate. If you have questions that weren't answered here, send them directly to me, copy Hillary on them. We'll be happy to try to address them. At the end of the day, as we get back to this videoing issue, I again want to do whatever we need to do to be sure that we're meeting the needs of our students and protecting their rights and of the faculty member and respecting them in their classes. So I think that we can come up with some ways of doing that. So with that, I need to leave. So you guys can hang around and talk a bit longer if you want, or we will plan another town hall here at the first of the year. I want to continue these. It seems like there's a good bit of interest and a nice way of getting some feedback and faculty engagement with academic affairs. So if I don't see you before, which for many of you I won't, have a happy holiday season. I hope everything goes well with the rest of your semester, and look forward to seeing you in the new year. Talk to you soon.
Great. Thank you.
Hillary, go ahead.
Yeah. No, just thank you, Provost. Thank you, Robin, for answering all of our questions. And yeah, if you have other feedback, send them to me or Rick. If you don't feel comfortable going the Faculty Senate route, that's fine too.
Very good. Thanks so much.
Thank you. Have a great day. Happy holidays. Happy end of semester. More exciting. I am here if anyone wants to. I'm going to stop recording, but if anyone feels like chatting.